Hey everyone, today we're going to talk a little bit about this. It's called Secure Port IV. Some of you have seen me use this on some of our central line dressings or around some ports that maybe are a little bit wiggly. So I just wanted to kind of show you what this product was and how to use it briefly. So this is located in our supply room. Some of the supply rooms do have it located with the medications. So we're working on getting that moved around, but it is very small. Just for scale, you can see here. It is not a large product, and there's quite a few of them stacked in there. It's not a very expensive product. When you think about it for the grand scheme of things, it's about $6 per container of this. And what's inside of here is it's very similar to like a Dermabond, but what it's specifically made for is to help secure the insertion spot around your central line sites. So sometimes those central line sites, even though they're sutured in, they can be a little bit wiggly, and that wiggling movement can make it really hard to dress them, keep that dressing inclusive on it. It also can make it so that they're bleeding or oozing, and also the hole around there, if it's not, if it's having any of those things, it's a natural spot for bacteria to kind of try to migrate in. So what this does is it kind of acts as a seal and closes up that hole around there and makes it so there's an extra layer of protection. So what I've been trying to do in a lot of dressings, especially in lines that are these larger lines or a line that's maybe in the groin, I've actually really been doing it on most of the dressings that I do, is I've been taking this and been using it at the insertion site. So I'm going to show you how to use that at the insertion site and then give a couple other quick tips on it. Okay, so the product is opened up, and you should be doing this if you're putting it on an insertion site, we need to be as sterile as possible. So it's okay to dump it on the sterile field if you're doing it that way. But if you look here, there's a liquid in the bottom portion of it, and the top port is kind of like a nozzle. Nothing happens though if you turn it upside down, because if you were to pop this part off, you would see that there is some tinfoil essentially here, and this is what's keeping your liquid in there. It looks like there is not enough liquid to do anything in here, but a little goes a very long way. If you look on the inside of this, there's a little smaller circle, and then you see inside there's that pinhole. That's where the glue is actually going to be traveling out of. But what we need to do is we need to get that smaller circle to puncture this tinfoil. And so what I usually do, obviously I'd be doing this with 2 hands and it wouldn't be me touching the end of it. But what we want to do is we want to take this product, I usually leave it like this. You can either push it straight down on the table or you can push it with your finger, and you're going to hear it pop a little bit. And after you do that, still nothing is going to come out. You're going to invert it and still nothing will come out, because what you have to do is you actually have to squeeze your fingertips on this. And what they tell you is a dot, not a lot. That's what they do when they give us, they told us about this product and how it worked in general. So I'm going to show you kind of on a piece of paper, because I don't want to glue my office mate's chair. That would not be very nice. Actually, let's put it on the outside here. So when we squeeze in the end of it, you're going to see it comes out, and it is the consistency of a nail glue, so you can see it spreading there. But it is the consistency of a nail glue. So what I usually do around there is when I'm squeezing it, I go dot, dot around the insertion site. Let's do that. Dot, dot around the insertion site. You can even do a little half moon around there. The other thing that's nice, if you have a dressing that is not sticking very well, I still would recommend using a tube of this or a little bit of this around the insertion site. And then with the leftover, you can actually kind of paint a little bit of a border around your dressing and get that, or on the skin or where you're going to be placing the dressing. So that way, hopefully this will help the dressing stick. This does come off really easily. It comes off with your dressing removal. You should be using adhesive remover on our patients with special considerations or any kind of sensitivity. But just make sure that you consider this product when you have a line that you're changing your dressing on. Again, $6, and it could keep your patient infection free and also could save you from having to do another repeat dressing. Oh, the only last thing I wanted to say is, unlike other products, this is not going to fully dry. It's going to see, you can actually, I got a little bit on my finger. It's a little bit tacky when it dries, so you're going to see a little bit of a shine. So I usually let it dry for about 30 seconds, and then it's going to be a little bit tacky, and that is when we're going to be good to go. You can still put CHG on over top of this. You can still use silver over top of this, all of the things. This is, again, just to close that seal, and then if you needed to, you can use it to help that dressing stick. Thanks. Have a great day.